Hi. The circulation promoter is fantastic for treating anyone with foot pain, any kind of problem with your lower limb, in fact, for your entire body. But for the lower limb, this is a especially excellent device for treating yourself. If you suffer with poor circulation or nerve damage from diabetic neuropathy, if you had polio, if you had a stroke, you have a sciatic nerve problem from a degenerative disc or herniated disc from your lower back that causes pain down your leg, this device is fantastic. But for those of you who got bad circulation, this is a must-have, especially if you suffer with diabetes. Diabetic neuropathy can be fatal because loss of sensation in your legs and any kind of cut in your feet as a result of not knowing what you're stepping on can cause infection and obviously very serious problem. So it's very important to use this on a regular basis to keep the circulation flowing in your limb, and not only that, to wake up the nerves, to activate the nerves so that the sensation comes back, so that your motor function, like the muscle function, becomes normalized, so that you have the power, so you can have the coordination, so that you can live a healthy life, okay? By using this, I believe it can keep you function better, so that you can stay active, and that's very important. Now, my circulation promoter is very different than others. The main reason are the following. One, it's powered by the technology of the pain therapy machine, okay? This device is known, okay, and scientifically proven to help relax your muscle, relieve your pain, and promote circulation. We have clinical studies that proves it. There are many devices out there that mimic our type of stimulation, but they do not have the proof that it really works. So I urge you, stick to things that are really proven. This is important for your health. Now, another thing that's very important about our device is it's much more powerful, okay? Because the power that comes from this unit, there's nothing else, okay? This little device will give you more power than the plug-in units that we use in the hospital. And the fact that using this unit allowed this entire system to be totally portable because it just operates on batteries, okay? There's a little box in here that hosts the batteries. So because it's operating batteries, you can use this anywhere. You can use it in the house, any room in your house. You can use it in the car. When you're traveling, you can bring this with you. You don't have to worry about finding the right plug. This just makes it much more practical and much more effective because of that. Now, traditionally, a lot of foot massagers and stimulators are not powerful enough. They don't give you the stimulation you need to actually wake the nerve up, to activate the function again. I have done a couple of things here, okay? We have increased the power for this device just for this. Not only that, I had developed some new superconducting electrodes, okay? Those electrodes have a special coating on it that can give you much better conduction. Now what you do is you just put some water on this and activate that conduction property, okay? So I put it in the key area, in the mid-arch, and in the heel area. And the fact that you can take it out, you can wash it if you need to, just run some water over it. Very, very simple, very effective. Now to start using this, okay, there's basically a wire inside here. Now this wire can be removed, but you never really need to remove it. It have a different type of an end here that is designed to fit just this machine, all right? So you just take that out. And first what you do, there's a little plug here. You just push it in and push it in all the way, okay? And make sure you insert the batteries here. And I recommend you use alkaline batteries. Alkaline batteries will give you better treatment because you have a nice steady power until it's all gone, then it stops. But if you use a rechargeable or the regular batteries, the power dwindles, okay, over time, so your therapy is not very good. So get yourself alkaline batteries. It will make your machine work much better, okay? So that's the basic setup. Now the device is very easy to use, okay? To turn on the power, there's a little dial here. We just click it on, and that turns on the power. And you have 3 different modes, okay? Mode A, B, and C. Now each mode will give you different types of stimulation. Now the results are the same, okay? Basically, generally, it relaxes your muscle, okay, and help to relieve the pain and improve circulation. For those who have really bad nerve damage, I suggest using mode B because this one is a very strong and very powerful stimulation that just wake up your nerve much faster, okay? So mode B for the very serious, problems that you may have. And timer, you can set for 10, 20, or 40 minutes. And what the device will do, it will shut itself off with time. So you can be, getting a foot massage or using this on different body parts. and the device will shut itself off. So if you have trouble sleeping, use this before you go to bed. It'll help you, sleep much better. So that's the basic, instruction for using this. Now, what you find in your package, you have other wires that allow you to use this device on its own separately for the body parts. So you'll find a package of wire. Now, this wire is different than the wire that's on the machine. Let me open it and let me show you. Now, this wire has a different plug, okay? That'll allow you to plug into this machine here. And then on the other end, you have this, which allow you to plug in the body pads. So you have one pair of the large flex tone pads. This is good for any larger body parts like your lower back, your hip, your knees, okay, rotator cuff, different areas. The large pads are fantastic for that. And you can refer to the other portion in this DVD to know how to use on different body parts. See, just like that, we can hook it up. And now this device can be used for treating, other different conditions like back pain, hip pain, knee pain, etc. So very handy. Now, you're also going to get a pair of these smaller size pads. And those smaller pads are fantastic for treating neck pain, headaches, okay? Any kind of like a TMJ, jaw problem, facial, if you have facial paralysis or facial toning, you can use this for. So smaller pads and big pads, this is basically how you, connect. And again, refer to your instructional DVD to learn how to use it for treating other conditions. Okay, so now I'll go ahead and show you how to treat your feet. So we'll plug this back in to the original wire. And you're going to put this on the floor. Now, your system comes with a little bottle, and you can put water in it, okay? What you're going to do, first thing, is spray on the foot pads, and especially over the special conducting red electrodes, I put extra water. And spray a little water on my feet, bottom of my feet, on both sides, just like that, okay? Just put your feet on, and turn it on again. There's a little dial here. I click it on, and I keep turning it up until I feel the stimulation. Now, for those of you with nerve damage, you may not feel anything. For someone with normal functioning nerves, usually you can start to feel it around 2 on the intensity dial. The intensity dial goes from 1 to 5. So for most people with normal nerve function, you should start to feel around 2. If you don't feel it, that means your nerve is damaged, okay? So basically what you do is you keep turning it up and turning it up, and even if you go full maximum to the level 5, even though you don't feel it, don't worry, just keep it on, okay? Keep it on. What I find, with in practice and with other customers and patients, that some of you will actually take 20 to 40 minutes, and for some of you, even 1 hour before we can wake the nerves up, okay? If you have diabetic neuropathy for a long time, or if you have sciatic nerve disc problem for a long time, the nerves, they become numb and basically almost dead, if I would use that word, okay? But we can wake it up. With this device, I've seen it, okay? I've seen people who had numbness and no sensation in their feet for years, 10 years, 12 years. After about 1 hour use, everything starts to work again. So don't give up, okay? So like I say, if you have more severe nerve damage, I would use B, okay? Because this one really gives it a nice stimulation. It just wakes the nerve up, all right? Just keep using it until you feel the sensation. And then once the nerve wakes up, oh, you're going to see something different, something really nice and surprising. The power start to come back, okay? You're going to feel more and more as the nerve and muscle start to work again, okay? And then, then you can actually turn it down to the point where you're comfortable and just use it like that. Now, how often to use it? I would recommend you, keep it on until you feel the stimulation. And from the point when you start to feel the stimulation, continue to use it for at least 20 minutes, all right? That way, you actually retrain the nerve and muscles to work properly again, right? Very simple, very effective. Now, there are certain things that you should be aware if you're a diabetic. If you suffer from nerve damage, you should use this every day. I recommend use it first thing in the morning, use it before you go to bed. When you come home from a long day, your feet is sore and numb and painful, use it again. There's no worry about overusing it, okay? There's no drugs involved, okay? It's safe practically for everyone. If you're pregnant, you should not use it. If you have a heart pacemaker, do not use it. But generally, it's very safe. If you got metal implant, you can still use it. Now, here's some other uses that's very good with this device, okay? If you suffer pain in your foot, if you have what we call heel spur, okay, a painful spot right here, it's actually hardening of the attachment of the ligament, you can use it. If you got what we call plantar fasciitis, where you got pain, across the arch of your foot, especially first thing in the morning when you put weight on it, use this. This is very good for that. If you have any kind of joint pain, arthritic joint pain in your toes, what we call bunion, when you got a large bony protrusion in your first toe, you can use this, okay? Any kind of arthritic pain in your foot, Morton's neuroma, where you get like a really sensitive spot underneath the front pad of your foot, you can use this. Now, for those of you who are athletic, okay, if you have a history of sprained ankles, this is fantastic, okay? If you have sprain on the outside or the inside, most people get on the outside, this is very good for stimulating healing, all right? So if you have, any type of injury in your leg, this is fantastic. Those of you who get restless leg syndrome, where you get numbness and pain and just refueling your legs, use this again, before you go to bed. Those of you who just get swelling, water accumulation in your ankle, okay, because either your blood vessel is not very healthy or your lymphatics not very healthy, this is absolutely must for you because you don't want all that water accumulating in your leg. That's very hard for your entire body. So use this to help pump the fluid because when you use this device, you're going to see that it'll actually help to pump the fluid that's been sitting in your ankle, sitting in your lower limb, because it activates what we call the second heart. The calf muscle will start to contract, relax in different rhythms. And that's the unique thing about machine. It has many different types of stimulation. It's constantly changing, not like other devices out there. This really works much better because of our unique auto-modulating pain-relieving waves that also activate, okay, the pumping of the muscles inside to remove the fluid. Okay, so if you have water accumulation, please use this and use it regularly, and you'll find you'll feel healthy and just function better. Some of you who travel a lot, you may want to actually use this right in the airplane because by keeping the blood flowing, it may help to prevent blood clotting, which happens a lot with people who fly. Those are all the basic uses. Okay, so again, if you want to use this for treating your knee, you can use the big pads, put over your knees. It's fantastic, like those large Flextone pads. You can use this on your knee, for your back, for your hip, different body area. So again, watch the other portion of this instructional DVD, and you will learn how to use it to its full advantage. Okay, enjoy, and please tell others. Okay, so many people out there suffer with similar conditions as yours. Okay, or things that you have learned from watching this DVD, but they have no help. They're doing all the wrong things, and they're getting worse with time. You need to help them. My purpose in life is to allow you to live a more active, a healthier life with less pain. Okay? I want to allow you to do it in the comfort of your home so that you can have it regularly. You get the treatment when you need, and that's very important. I want you to stop relying on taking a pill or having to run for an appointment every day. I want to give you something that's easy, very safe, and very effective, and very affordable. And I want you to help others that you know. Please enjoy this and have good health.